do feel that, as I say, it always has to get worse before it gets better. I think the fact that, Roe v. Wade has been overturned, it has created sort of this sense of, urgency, not just because of, women's reproductive rights being put in peril, but you're seeing just what one aspect of healthcare being removed does for millions of people. The prospect of everything being covered. Once it's implemented in the United States, it will never be taken away, because then it wouldn't be a riot of a couple of million people. It would be, everybody. And they know that. And that's why I think in this moment, when you're able to tell people, by the way, whole Washington will cover reproductive rights. So once that, I think, really resonates with a lot of people, that will have a tremendous impact. Where do you guys currently stand right now? Because obviously getting the ballot signatures is huge. And that could be the difference between whether or not this is going to take multiple election cycles, or maybe you get it done in the first shot.
Yeah. And, I don't want to give a firm number today just because we collected so many signatures during Pride and we haven't had a chance to collect them and count them again. So I don't want to lowball us. We had about 15,000, last time I checked, and we're collecting thousands of signatures a week. And there are big events happening, and we're getting a lot more volunteers involved as well. So, we're seeing a lot of growth. We're getting a lot of signatures. We're continuing to build our infrastructure. But it's hard to get a firm read on where we are, because when we report a number, it's fully collected, counted, data entered. And then what I can show you, actually, I thought you might get a kick out of this. Let me show you. So my house is the final resting place of the petitions before they go to the Secretary of State.
Right. So you've got stacks.
Yeah, this is what 1,000 looks like. And then I've got a stack here of I busted these out for the show, but 5 of them there.
Is that 6,000 you got?
At least.
That's amazing. And how many do you need is the big question.
All across the state. I'm hoping that it's not too long before I'm telling you that I had to rent a storage unit or something. But for now, they're in one of my closets. Keep them safe. They go to the Secretary of the State at the end of the year in just one big batch. So.
Okay, so it's an end of year timeline. And how many do you have to collect? Is it a percentage of voters or something like that?
Yeah, so it's 8% of the votes for the governor in the last election, which unfortunately means that this is the most signatures that we've ever needed to collect for any ballot initiative. The turnout for the last election, it was a Donald Trump election. It was very high. Including very generous margins for. Yeah, I
was going to say you have to have overage.
Yeah. So it's about 325,000 signatures that you need.
Wow.
But they recommend a 15 to 20% cushion. Mm-hmm. And because I like round numbers, I bumped that up to 23%. So we could just call it an even 400,000. So 400,000, I think there's actually another, the Secretary of State this year was recommending 405,000, but again, it's a pretty generous margin. I think we're going to have a pretty good rate of valid signatures because we usually know how to check for that. You can register people right there. Most people, if they're not able to sign, they might be interested. They kind of start and they take a look and they go, wait, do you need to be a Washington voter? And we explain. And so I don't think we have an abnormal rate of invalid signatures or anything like that.
Yeah, I think this is really amazing. The more when you're talking about an organization like yours, this to me seems like a much more effective, efficient way to not only get it through, but build your coalition as opposed to just campaigning for, say, whichever candidate supports, your mission or spending your time lobbying your state legislators and getting people like this is such an easier sell, I think, to regular people. And then once you sell them and they sign, that's it. You don't have to call and remind them to get out to vote like 3 times, you know? So like this to me seems like a really the best possible scenario for an organization like yours.
I agree. And, you know, I think one of the things about it is that ballot initiatives are really hard. It's a lot of work. It's a huge ground game. And so I think there can be a hesitation to run them, especially because it's so easy to feel like if you run a ballot initiative and you don't make it on the ballot, or if you run the ballot initiative, but you lose the election, that the effort was wasted. I think we've already kind of talked about how we really don't believe that's the case.
Correct.
It's still, I mean, let's imagine a scenario where we get on the ballot, but we lose the election. I mean, that means that we talked to 400,000 people across the state. We convinced them to take action on universal health care. It might be like a lot of them, it's the first time they ever even thought about it. You know, sometimes I try to get a signature for someone. I say, this is like universal health care for Washington, or I say, this is statewide Medicare for all. And they go, oh, I thought we already have that. You know, and so you have to explain to them, actually, there's 500,000 people without any insurance in Washington. And by the way, you know, the rest of us are underinsured, right? We're talking about making this way more affordable, way more stable and secure. And so, you know, you have to explain it's not simple stuff. You know, healthcare policy is complicated, and there's been a lot of propaganda released into the public consciousness that you sometimes have to sort of explain away. But yeah, I mean, that would be an incredible number of people to bring into the like movement for healthcare justice, even if we didn't make it this year. So, I guess like the other thing I'll say is, you know, you kind of said at the beginning that there aren't any other states doing this, and we're not the first. States have tried this before, even going back, you know, a number of years. You know, just like with federal Medicare for all, just like with every other approach, I mean, nobody has achieved universal health care in the United States yet, right? So we got a lot of losses on the record, unfortunately, but that's just sometimes how justice and progress is. I mean, how long did it take us to abolish slavery, say, right? Or give women the right to vote? So, you know, the fact that there are past failures doesn't mean that that's always going to be the case. But I personally would say that I kind of got into this game because Colorado got it on the ballot in 2016. And I was like, wow, that is so incredible. And I know that we have ballot initiatives here because we had just legalized cannabis and gay marriage, right? And so I was like, this is such an obvious way to continue the work of Bernie Sanders. This is an obvious way to, you know, we expanded Medicaid, but this is like a much bigger expansion. It's a true universal expansion. And so, like I said, that idea was planted in my head and it wouldn't go away. And so now I'm working on it. But, you know, Maine ran one last year. They didn't make it. You know, COVID was tough for them, just like every other ballot initiative campaign. But, you know, Maine and Colorado, I think, they have strong organizations that have some experience in this space, could run them again. And I get messages all the time from people who see something as simple as like this poster was getting around on social media. And sometimes people they'll just like quote tweet that with their governor, right? Or a local organization or something and say, hey, couldn't we do that in Minnesota? Couldn't we do this, you know, in Florida or wherever I am? And I really think that what would like growth of this movement would be multiple initiatives running in the same year, you know, and forcing the medical industrial complex to like, you know, run interference against all of them at once, split their attention, split their resources. Like, man, I got to just keep putting out all these fires because people keep organizing for universal health care. So I think that the more that we can get involved in this, the more campaigns we can have running, the better. And I don't know if I've gotten a chance to mention it on this show, but I actually helped co-found an organization just last October. It's very new, but we've had a number of actions that I'm quite proud of. And that's an org called Medicare for All Everywhere. And the idea is, we think that this is in order to win like federal Medicare for all, we need 50 states working on it, in coalition with one another. And so we're trying to build that 50 state coalition that's working both at the state level and at the federal level, but most importantly, in coalition with one another, to make this really too big to defeat.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.